The Changing Economic World, podcast number 5 on global inequalities in wealth. This podcast covers why LICs often have worse healthcare than HICs, what the term TNC stands for, and some of the advantages and disadvantages that TNCs can bring to a country. A global scale consequence of uneven development is how LICs have become dependent on HICs and some NEEs for aid. Many LICs have had to borrow money from the World Bank to pay for hospitals and healthcare and are now heavily in debt. The shortcomings of healthcare in some West African countries was shown by the Ebola outbreak of 2014-15, which resulted in over 11,000 people dying from the virus. Most deaths were in Sierra Leone, Guinea and Liberia. Sierra Leone's hospitals have deteriorated over time due to the country's low income, indebtedness and civil war. There is a global imbalance between rich and poor. Some countries, particularly in Africa and parts of the Middle East, have lower levels of development and a poorer quality of life than richer Western countries. Imbalances also exist within countries. Areas of considerable poverty can be found in parts of the UK and USA, and great wealth in some of the world's poorest countries. Inequalities exist at all scales and in all countries. There is, however, a clear link between a country's development and the wealth of its people. The most developed countries enjoy the greatest wealth. Wealth in the form of gross national income, GNI, is often used as a measure of levels of development. Disparities in wealth can be studied using a Gini coefficient. This is a ratio with values between 0 and 1.0. A Gini coefficient of 0 would mean that everyone in a place had exactly the same income. A score of 1.0 would mean that all the income in a place was controlled by a single person. In general, LICs and NEEs have a high Gini coefficient. Levels of development are closely linked to health. LICs are unable to invest in good quality healthcare. In the world's poorest countries, healthcare is often very patchy. There is a wide disparity between causes of death in HICs and LICs. In low-income countries, 4 in every 10 deaths are among children under 15 years, and only 2 in every 10 deaths are among people aged over 70 and over. Whereas in high-income countries, 7 in every 10 deaths are amongst people aged 70 years and over. LICs have complications in childbirth as one of their main causes of death among children under 5 years, whereas in HICs the main causes of death are chronic diseases such as heart and lung diseases, cancer, dementia or diabetes. Only 1 in every 100 deaths is among children under 15 years. Malaria is a life-threatening disease caused by parasites transmitted to people by infected mosquitoes. In Africa, 1 child dies every minute from the disease, yet it is preventable and curable. In 2013, malaria caused over 500,000 deaths, mostly among African children, who account for 80% of malaria deaths worldwide. Malaria is concentrated in the tropics, where the climate allows malarial mosquitoes to thrive. The wealthier and more developed African countries have fewer cases of malaria due to vaccination programs. TNCs. TNC stands for Transnational Corporation. It is a large company that operates in several countries. A TNC usually has its headquarters in one country with production plants in several others. TNCs locate in foreign countries in order to take advantage of tax incentives, cheap labour, more relaxed environmental laws, or access to a wider market. The advantages of TNCs are that companies provide employment and the development of new skills in a country. More money is spent in the economy, and investment by companies in local infrastructure and education can see benefits on a local scale. Other local companies will also benefit from increased orders or additional infrastructure. The disadvantages include local workers are sometimes poorly paid, and the working conditions are sometimes very poor. Management jobs and high-paying positions often go to the foreign employees brought in by the TNC, and much of the profit generated by the company leaves the country and goes abroad to its headquarters. You may now like to try one of the following exam questions. Explain how global inequalities in wealth can lead to disparities in health. The wealthiest 1% of the world possesses more than half of the world's wealth. Suggest how and why this has happened. Assess the costs and benefits of TNCs in reducing global inequalities in wealth.